It's great to have back on with us Dr. Fahmi Farah, one of North America's leading cardiologists. And, Doctor, it's great to have you on the program. Let's tell folks about you, and welcome back to the show.
Hey there, it's great to be back on your show. I am Dr. Farah. I'm an invasive cardiologist and CEO of Bentley Heart Medical Center, also the director of Global Health Lines Foundation. And you can find me at www.drfahmifarah.com.
Outstanding. Thanks for coming back, and appreciate you joining us on the show. Okay, we've got change in the clocks that are coming. And, this coming Sunday, local time, 2 a.m., the clocks are going to be rolling back 1 hour, daylight saving time, not savings, as many have pointed out. But let's talk about this. Is this a situation where the clock rolls back, less daylight? Does that create chaos on the body with that rollback?
It can, actually. With any kind of time change, it can affect our circadian rhythm. That's what dictates our sleep cycle. And some people are very sensitive to it. So even that 1 hour change, if we're not prepared for it, it can throw us off and can cause major sleep disturbance.
Okay, absolutely. And, I guess the good news, we'll get an extra hour of sleep, but the other side of that, it's going to be dark as, pockets by later afternoon for the next few months, and that whole idea of springing forward not till March the 9th, and that's when daylight saving time is going to go on. Now, you think about, why do we have this in the first place? Is it a situation where the body, it reacts to light? You mentioned the circadian rhythm that everybody has. What is that? Is that like a 24-hour cycle that determines when we fall asleep or get sleepy?
Yes, kind of. Circadian rhythm is what determines when you fall asleep, when you wake up. That whole rhythm is what it entails. And, for example, just to make it a little more clear, when we travel and we go to different places with different time zones, we can't fall asleep because our body is used to, our circadian rhythm is used to this time pattern. So yes, it is essentially the pattern of sleep and the timing of it.
Okay, what does that do to the heart? Does that create some irregular issues that may develop with that heart? How does the body react, in other words, with that?
It can have an impact on the heart and your overall body. Sleep is a major component of your overall health and especially your cardiovascular health. And as you probably know, that sleep disturbance is one of the major risk factors now considered for cardiovascular disease by the American Heart Association. And so if you're not sleeping well at night, it can have an impact on your cardiovascular health. It can increase risk factors, other risk factors like high blood pressure. It can also increase the risk of arrhythmia and things like heart attack.
When somebody hears things like an arrhythmia, that is what, like an irregular heartbeat? How can that be described?
Yes, it is. Arrhythmia, there are many different types. It just means that the rhythm of the heart is not regular anymore, and so you're having erratic rhythm, irregular skipping heartbeats, and there are many different types of arrhythmia.
And that's got to be scary. I mean, if you are maybe sitting down and you feel your heart skip a beat, it's going to be like, okay, what is that? Do most people even feel that with the arrhythmia?
Often people can feel it, especially if their heart is skipping beats quite a bit, and if it's going really fast, they can have symptoms with that, symptoms of palpitations. Sometimes they can have chest pain and trouble breathing. But you asked a very important question. There are times when people won't feel it at all, particularly with atrial fibrillation. I have a lot of people where it's silent, so people can't tell at all that they're having symptoms. And that's why getting your heart checked up is very important. Even if you don't know what's going on inside, there may be a lot going on.
Absolutely. That's why I need somebody with an MD behind their name like you to help folks understand the importance of this. Now, the time change, with those that have had children, teenagers, as an example, I mean, they have got such an erratic sleep behavior pattern, or they could be really heavy sleepers. My daughter, when she was a teenager, would sleep for 10, 11 hours straight. Get up and feel fine, but, maybe that's just part of that cycle there. But can the change of the time back an hour, can that affect younger people like teenagers, as an example? How do you see that?
It can. It can impact people of all age groups, even those who are younger. Like just getting adjusted to that most of us are pretty routine based, and when we get thrown off, that 1 hour can mean a lot, especially for teenagers like who are schoolgoers. They now have to adjust that timing of when to go to bed, and they now have to get up a little bit earlier. And you mentioned something like the darkness. The time of darkness is a little bit longer during fall, especially because day is shorter, so we get less sunlight exposure, and that can have an impact on your mental health as well.
Okay, and expand on that, because does that maybe create situations of like maybe more depression coming to the table? Can that result from that? Would it change?
It can. It definitely can, especially in areas, like East Coast, West Coast, where we have even less sunlight during this time of the year. Depression is something that increases in number. The rate of depression is higher. For those who have pre-existing depression, it can get worse, the symptoms. So during winter times, it's pretty well known that depression rate can go higher during that time, and more so in certain regions, and also certain occupations. For instance, those who are working, like odd hours, like doctors and nurses, they have to get up very early in the morning, and they work long hours. So during the winter months, a lot of them are never getting to see sunlight. So depression could be a major problem.
Yeah, and if, say, you are a night worker, work overnights 11 p to 7 a, or you work regular hours 9 to 5, if you are maybe working in, say, and I'm going to say broken shifts, in other words, that if you're working deep nights 1 week, 11 p to 7 a, and then all of a sudden you got to switch back to 9 a to 5 p, does that create electrical, or I should say, heart issues? When your body's jumping around like that on a schedule, does that create a major issue?
It can. Like I said, that sleep getting thrown off, that sleep disturbance, there are some studies that have shown that it can have an impact on your cardiovascular health. Anxiety goes up, and as a result, the other risk factors like high blood pressure can be high, and it could have a long-term impact, and even short-term, like, people can, like I said, have palpitations, the heart rate can be elevated, blood pressure can be elevated, so it can have a number of impact on your entire cardiovascular system.
All right, Colin. All right, I would imagine, too, that the risk or the chance of accidents go up, like on the roadways, more darkness. Getting darker earlier, it's going to cause more wrecks. That could be one of the other extremes.
Believe it or not, yes, they did look into that, particularly with this time change, specifically to see what happens with car accidents. And yes, usually the week of the time change, there is a correlation between that and an increased number of car accidents, just probably because people just didn't get that sleep. They're anxious. So it's a mixture of things that probably lead to that.
Okay, absolutely. Do we even need it? I know it's a personal opinion, but do we even need these time changes? I'm thinking, like, what a pain to go through this. Is this even needed at all, in your estimation? I know it's a personal opinion, but what do you think?
It's, like in my opinion, I'm a very routine-based person, so I don't see the need for it in my life. But I have heard the other side as well. There are pros and cons. For instance, during summer months, we do enjoy the sun for a little bit longer as a result. But whether it's truly needed, I question that.
Okay. Yeah, absolutely. And I would imagine that you've got to also go back on a time change. You have to change, like, the settings in, like, the heart monitoring gear, or does that do it by itself automatically, like your phone? What are you going to do with your equipment? Does that come into play?
Well, your equipment kind of, it depends on what kind of equipment we're talking about. For the most part, everything is kind of auto-adjusted, especially if we're talking about like devices internally, like defibrillators and pacemakers. You don't need to do anything. Those are pretty much automatic. External devices, it all depends on what kind of device you have.
Okay, I'm just kind of wondering about that, if it's one of these universal rituals that everything's got to be changed back. But like you mentioned, some things simply just do it automatically. Thank the Lord. Let's just leave it at that. All right, we got a break for a few minutes here, and Dr. Fahmi Farah is on board with us. And if you got a question or a comment for her, all you got to do is call us. What's going on with you? And I'll open it up to any phone questions you've got for her. If you want to maybe get some answers about, I'm just going to throw this out. I saw an ad for heart failure. A lot of them are showing up on TV. What is that? These different kind of medical regimens, medications that are available out there. We'll get the definition of that. Do you feel tired a lot, in other words? That could be one warning sign there. Stay tuned. Bunch more straight ahead right here on SiriusXM 146. Be right back.
On Road Dog Trucking News.
Hey, drivers. Yep, well, welcome back. And Dr. Fahmi Farah is on. One of North America's leading cardiologists. And Dr. Farah, thank you very much for joining me on a program. Let's get all of the contact points out, website, socials, and the old-fashioned way by phone. Where can we find you?
You can find me at www.drfahmifarah.com. Also, you can call us at Bentley Hart at 817-720-5185 and social media at Fahmi J. Farah, Instagram, and X.
All right, absolutely. And I do want to point out on the side note that you will see patients that are, not Dallas-Fort Worth, but I mean anywhere with telemedicine, right? And that's one of the great things about what came out of the pandemic. Horrible, of course, with the pandemic, but medicine certainly learned a lot and opened up a lot of doors with telemedicine, right?
Oh, absolutely, yes. You can reach me from anywhere in the country via telemedicine. We provide that.
Okay, very good. Thanks again for doing this. Now, I mentioned that we're getting ready to turn the corner, of course, going into November and then December, and it's going to get colder and snowier and icier. And where's the plane ticket to Miami to warm up? No, that aside. But what should folks be doing in order to keep maybe an exercise regimen going in cold weather, where they don't overexert their heart, where it could go into cardiac arrest, or maybe something worse like a fatality? What can we do with exercise?
Yes, very important to keep up with your exercise regimen even during winter months. So my advice would be in areas where it snows a lot and it falls, like quite cold, the temperatures fall drastically, to stay indoors and try to get a treadmill or the stationary bicycles. All of those are a great way, even at your own home. You can continue with those, do little weights at home. And, of course, those who can afford or have the ability to go to the gym, keep up with that.
Okay, very good. And that's such an important point because I think so many of us indeed do become couch potatoes during the winter, get a blanket, curl up, watch TV, and that old notion of, well, I'll do it tomorrow. When it comes to exercising, well, maybe you put it off one day, then two, and then it turns to five. That's not doing your heart any good, being sedentary like that, right? You got to get up and move it.
It's not, exactly. Sedentary lifestyle is not good. It's one of the major risk factors for heart disease. Winter months, no exception. You got to get out there and got to stay healthy and active.
Absolutely, and I love the way that you've got part of your exercise is doing ballroom dancing. And I want to make mention that you were, I think, a world leader. You got an award for that, and that's marvelous. And again, it's going to get down to that even if you are exercising in your home, there's something you can do, like maybe sit-ups, or you can maybe do push-ups, or maybe even better, do the push-aways. What I mean by that, push away from the table. Don't overeat. That can cause real heart problems, right? Do the push-aways. What do you think about that? What are your thoughts?
Oh, completely agree. Yes. Maintaining a heart-healthy diet is so important, especially during the winter months. You know, we're getting ready to get into the holiday season, and food tends to be very unhealthy during this period. A lot of people indulge in more alcohol intake. So all those factors, you got to pay attention and be careful and just do everything in moderation. And yes, I do dance. It's indoors. You can do it all year round.
Yes,
I encourage everybody to start dancing.
Yeah, oh, absolutely. Are there any videos up of that on YouTube? I bet that's a lot of fun to see. And when are we going to find you on Dancing with the Stars? I saw that last night. We got to get you up there. That's great.
Funny. Maybe one of these days.
Yeah, no one disturbed. And the thing is, have fun with it. Because, you know, exercise, good for the heart. It doesn't have to be a drag. Correct? I mean, find something you like and get that old ticker going, right? Enjoy it, in other words.
Totally agree with that. You got to find something that totally takes you away from your daily stress. Makes you feel like you're getting away from all your things. And for me, you know, I mentioned it so many times, dancing is one of those. Just find something that you enjoy so you can get all of that in one activity.
Absolutely. Doctor, thank you very, very much for joining me on a program. And got to get ready to wrap it up. I got about 2 minutes left, and that's Dr. Fahmi Farah. On the line with us, one of North America's leading cardiologists, and she is in the DFW area, offering you guys great information about your heart. You got to take this information to heart, and make sure you get to your doctor when you got questioned, and she is available by telemedicine. So just kind of keep that in mind. Doctor, one more time, website, social, and the phone number. Where can folks find you?
You can find me at www.drfahmifarah.com at Bentley Heart Medical Center. Phone number is 817-720-5185. You can also find me on social media at Fahmi J. Farah on Instagram and X.
All right, we got Halloween coming up. One quick question before I let you go. What's your favorite Halloween candy? Any favorites come to mind?
Oh, that's easy. It's Kit Kat. It's always been Kit Kat.
Yes, absolutely. Oh, those are so good. All right, Doctor, thank you very much for joining me on a program. Yeah, Kit Kats are indeed the way to go. And that's Dr. Fahmi Farah.